Hi, thanks for being with us today. My name is Debbie Garza. I am a pharmacist, and I'm currently the CEO of the Texas Pharmacy Association. I'm here today with Dr. Leonard Friedland, a pediatrician, vaccine research scientist with GSK, and he's been involved in the development of over 14 vaccines currently in use across the United States. He's also a member of the National Vaccine Advisory Committee, and he's passionate about vaccines. I'm thrilled to have him join us today. We're going to talk about vaccine hesitancy. What makes people have uncertainty about vaccines and their effectiveness? We'll dive deep into this topic and many more surrounding this interesting phenomenon in our culture. So to start with, Dr. Friedland, there are some patients who are not against vaccines. They're just hesitant about their children getting the full CDC recommended immunization schedule. What do you tell parents, or how have you worked with parents who decide to delay some vaccines or are hesitant about some of the others?
Yeah, thanks, Debbie, for bringing that up. As you mentioned, I've been involved in the development of 14 vaccines that are now widely used across the United States. And each one of those vaccines and every other vaccine that's available, of course, and licensed by the FDA was studied in a very specific way. And then the Centers for Disease Control and their advisory committee called the ACIP, the Advisory Committee on Immunization Practices, they review that information and they look at how the vaccines were studied in the clinical trials, and using that evidence, they make their recommendations. And so it's very important to stick to the ACIP recommendations because that's how the vaccines were studied. So they shouldn't be spread out unless there's data to show that it was studied that way and it is safe and effective to do that. The recommended schedule is the safe and effective way that's built on the evidence base around that vaccine. And so it's really critically important because we want to make sure that everybody is up to date per the recommendations so that they achieve the protection that the vaccines are intended to do and that the Centers for Disease Control is recommending that we do. Now, I know that the schedule can be a bit overwhelming for parents to look at, for healthcare providers to understand. So we just need to take the time, find out the education, and then as healthcare providers, as pediatricians like myself or pharmacists like you, as healthcare providers, it's our recommendation that makes the most difference to a family when their child is going to get vaccinated, or to an adult for that matter, who's looking to us for advice. So I would say in summary, the recommendation is the way that the vaccines were studied. And so the data, this is the evidence, and that's why they're there. And it shouldn't be changed because if it's changed, it wasn't studied. And we don't have the data around that.
And we don't have the protection that the children need. Absolutely. So in vaccine hesitancy and complacency are linked together. Many expectant moms believe that terrible diseases like smallpox and polio have been eradicated. Therefore, there's no need to get their kids vaccinated in their mind. What would you tell that mother and parents of children who believe that? And better yet, how would you convince them that getting vaccines is the right thing to do for their children and other parents' children?
Yeah, I know. So important. So besides being a pediatrician and a vaccine research scientist, I'm also a parent. And and I know how important it is to make sure that our children, have every opportunity to live a healthy life. So let me start with a personal experience that I think gets to this question. So I was a pediatric resident in 1987. It was my first year. And at that time, we did not have a vaccine to prevent Haemophilus influenza type A, also referred to as Hib. And as all the pharmacists know, the Hib vaccine is part of the routine pediatric schedule starting at 2 months of age. And there were 20,000 cases of invasive Hib every year in the United States at that time in children under the age of 5, predominantly under the age of 2. And every week in my hospital in Philadelphia, we had 1, if not 2 or 3, young children admitted with invasive Hib, with sepsis, meningitis. Case fatality rates were on the order of 2% in the United States. 1 in 200 families was impacted by Hib. Virtually every family in the United States knew some other family, somebody who had a child with invasive Hib. In 1987, at the end of 1987, the FDA licensed the first conjugate Hib vaccine. And within a very short period of time, within just a year or two, the disease was virtually gone in the United States. By the time I was a third-year resident, we weren't seeing cases in the hospital at all. There was more than a 99% reduction in invasive HIV as a result of this vaccine. It was, in my view, a medical miracle. Something that was so common was wiped out. It was gone. And today, young pediatricians, young nurses, young pharmacists, they don't know what this disease is. It's an absolute incredible impact of vaccination. And that's a vaccine given to young children. And I've seen this happen over and over with invasive streptococcus pneumonia, with rotavirus, with chickenpox. Chickenpox, people that have benign disease, not at all. Prior to a chickenpox vaccine being available in the United States for young children, there were 100 children who died every year due to chickenpox in the United States. There's a family behind every one of those 100 deaths. And now we don't see this through vaccination. And so what I say to parents is that vaccines are proven to be safe and effective, and they are recommended based on the evidence. And so it's not our job to convince anybody. It's our job to provide information and stress the importance, and that these recommendations wouldn't be there if they weren't there for the benefit of their child. And I think that's really critical. Our job is to do things safely and effectively. Everybody in the United States deserves the opportunity to live a healthy life. And vaccination is a critical part of that. And the pharmacist plays a critical role in speaking to families and people of all ages around the importance of vaccination and the benefits they can bring. And they're built on evidence. And that's why they're there.
Absolutely. Well, thank you, Lynn. Questions about the safety of vaccines occur very early in a mother's pregnancy. The perceptions about the safety and efficacy of vaccines are shaped by friends and peers, but they're also shaped by medical experts like doctors and pharmacists. Studies have shown that a very honest and transparent conversation with vaccine-hesitant parents can lead their children to get these life-saving vaccines. And I know you just spoke to that a bit, but could you expand a little more, particularly from a pharmacist's perspective or any healthcare provider, what is really key to include in that transparent, candid conversation?
Yeah, absolutely. I think a large part is listening to our family, our patient, understanding what their questions are, and then providing the information that they're looking for, and then explaining why this recommendation exists. And so we're not here to convince people what to do. We're here to listen and get them the information that they need to make a decision around the health of their family. And we can use stories about why this is so important. And I understand, of course, I have 2 children. My wife went through 2 pregnancies. Everything is so important. But when you look, for example, at influenza and pertussis, these diseases, influenza can be devastating to a pregnant mother. She could herself get sick. She could lose the pregnancy. And a baby who's born with influenza can get very, very sick because the vaccines for influenza are not recommended until 6 months of age. So we want to protect through maternal immunization against influenza. With pertussis, again, the vaccines for pertussis, whooping cough, start at 2 months of age, but the full effect is not until a few months later. There are multiple doses. And children, little infants hospitalized with whooping cough often can end up on a ventilator and ECMO and can die. And so these recommendations for maternal immunization for influenza and pertussis are there based on evidence judged by the Centers for Disease Control, the American Academy of Pediatrics, and the other professional societies, that the benefit is there to keep the mother healthy and her child healthy. And no family should have a little baby who's hospitalized for pertussis. It's something that's vaccine preventable, and no family should have to go through this. I've cared for children who've been on ECMO for whooping cough, and it's a harrowing experience for everybody involved. when you know that it potentially could have been prevented through vaccination.
So for everybody listening that may not know what ECMO is, can you maybe tell what ECMO is?
Yeah, thank you. I shouldn't have said that without thinking. So thank you for correcting me. ECMO is a type it stands for extracorporeal membrane oxygenation. It's a type of a blood exchange that can be used to oxygenate somebody who's essentially in a severe respiratory failure. So it's a step beyond traditional mechanical ventilation. It's used for the sickest of the sick. Unfortunately, we see some children who have some very young babies who get pertussis will sometimes need to go on ECMO to get them through the period. Another thing, if we're talking today, is also we want to make sure that our hospital beds are kept for people who really need them. Those ventilators, may be needed for somebody else. So we don't want to have somebody who's hospitalized with influenza who ends up on a ventilator when they could have had their vaccine and hopefully have prevented that illness, because we don't want to overwhelm our healthcare systems right now. So there's so many reasons that vaccination plays a critical role for public health and then also for individual patients. And we have a role here to help explain, listen, and then provide the information so people can make an informed decision.
No, absolutely. Well, thank you, Lynn. Your insights are so helpful and such good information. I think, it's key for parents and adults, for that matter, to remember to stick to the recommended vaccine schedules because they're evidence-based and those times are what's recommended. And all vaccines are proven to be safe and effective. So thanks for joining us. We appreciate you. Please be sure to hit the like or subscribe button to get notifications for future episodes like this. Thank you and have a great day.